Hi, I'm Paul Phrampus. I'm the director of WISER, the Winter Institute for Simulation Education and Research at the University of Pittsburgh. I want to talk to you a little bit today about WISER's collaborative model. And this is speaking to how do we develop our faculty, how do we develop our courses, how does the WISER staff interact with course directors or those that are building courses using simulation and other methods of innovative education. By way of a little bit of background, WISER sort of is the collaborative project of two major entities. One is the University of Pittsburgh, the Schools of Health Sciences. Largely we interact with the School of Nursing, the School of Medicine, the School of Pharmacy, for example. And its traditional university needs on the Simulation Center insofar as training students of various levels, also conducting research projects. The University of Pittsburgh Medical Center, the health system that we interact with, is a large 20-hospital health system. There's 63,000 employees. On the health system side, our education and simulation efforts are often aimed at patient safety, efficiency of operations, and those things that are related to risk management, team training, and the things that you think about when you think about the delivery of healthcare at the sharp end, that is the end where the patient resides. So at WISER today, we have over 125 different courses in our catalog. We interact with about 80 different course directors, and those are the folks that were the leaders in developing these courses. We have about 300 instructors that teach different courses across our different campuses of WISER. And I mentioned already, we talk about the WISER being on two sides of the healthcare coin, that being on the school side with the university and the health system delivery side with the UPMC health system. WISER is actually set up to be a purveyor of educational infrastructure, if you will. We're sort of a public utility. I describe it as we're the electric company bringing power, bringing resource to the educators to help them bring their ideas to life and create education, accomplish their outcomes. We're the connector, if you will, between course directors, those people that create programs, their instructors, and the students that they teach. We like to think of it as this model. And within this model, we look at our primary stakeholder as the course directors and the faculty who teach. Many people think of the simulation students or participants as the primary stakeholders or the primary customer, if you will. But at WISER, we like to think of the people that create the programs and actually do the training as the primary stakeholder, knowing that if those folks are taken care of and have systems in place to help them be successful, the students will have remarkable outcomes insofar as the programs that they undergo for whatever side of the training coin they're on, being the health system side, the university side. At WISER, if you look in the middle, we are sort of a support network. Myself, the rest of the staff, we are engaged with subject matter experts or people from the environment that have expertise in what they are teaching. Maybe it's a nephrologist teaching about the kidney. Maybe it's a nurse from the nursing school teaching pharmacology for nurse anesthetists. They come to WISER, we partner with them in a model where we bring the simulation expertise and different types of expertise needed to sort of create the innovative education environment and allow them to build successful programs. We don't try to make every single program look the same. We're very respectful of the fact that different entities teach with different styles and different flares. We have some baseline requirements, if you will, that sort of encourage people to use simulation very efficiently, very effectively. At WISER, we encourage the use of a blended model of education. It's very typical for us to have web-based education for the cognitive aspect to begin the study process. And then when they come on site to WISER, they have already used that pre-course material through web-based learning, pre-learning, maybe taking quizzes or completed demographic surveys before they come, so that the efficiency comes in. They are cognitively preloaded with the materials, and then they come to enjoy the hands-on and the power that the simulation encounter or the simulation program brings to the table. So overall, we're a support staff. We help with the adult learning principles. We help with the curriculum construction project. That support that's shown in the diagram here sort of breaks out into 4 major categories. And again, I'm speaking at this at a high level. Administrative support, technical support, data management, and curricular. So let's start and talk a little bit about each of these. The administrative support that people need oftentimes are just the scheduling aspect of the simulation center, the recruiting of instructors, if you will, the reminders to students that they need to show up for a particular course, the reminders to an instructor that they need to show up to a particular course. Some courses require outside certification, such as if we're going to award continuing medical education or continuing education credits to a course, all of that administrative work has to be handled in the background. The technical aspects are obvious. When you're dealing with high technology simulators, high technology audio-visual support equipment, we don't expect anybody to become an expert in that area. We like to partner with them, and we bring that expertise to the table. Data management is one that's often overlooked. How many of you have collected course evaluations or quizzes on paper, and then they sit around and they pile up and they pile up and they pile up, and sooner or later maybe you get a student, or maybe you do it on your own time, you enter all of this data into a spreadsheet or into a database program to try to get your outcomes. How many students came through? How well did they perform? How much did the simulation encounter increase their knowledge? All of those kinds of things are data. How much was your center used? Many different questions can be answered with data, particularly if it's automated and made available to the course director or the people that your stakeholders are that are interested in this particular set of information. Lastly is curricular development. Many faculty members are really good at teaching a single lecture, but many of them lack the expertise to combine many different aspects of curriculum components into what we would call a learning system or a course. And we help them with a project management plan. We go through, make sure objectives are clearly stated, well thought out, making sure they match the learning modality. So if they're pure cognitive and study objectives, we try to encourage that to be part of the online material. We try to sequence it, so build that scaffolding in the program so that we know that one needs to be competent in this block and this block before they can move to this block. And we encourage our course directors to think through that as the program is constructed. So what we end up with is a model that looks like this. The subject matter experts come on one side, the innovative educational expertise and simulation expertise is brought forth by the WISER team. We don't expect people to become simulation experts. We do expect them to become competent. We like to think that we're helping them develop an expert curriculum that can be delivered by competent facilitators, and we bring that expertise to the table in many different forms. In review, it's about the curriculum development, project management of curriculum development, administration, operations, all of those things that are sort of behind the scenes that people don't think about when it comes to executing a program, and they're trying to do everything themselves. And then that helps us develop expert curriculum. So if you think about this, for example, this is a picture of a cardiothoracic surgeon who is precepting surgical trainees in learning how to sew blood vessels end to end together. And for this, there's a model that is a pig model. So we go to the butcher shop, and the parts that would normally be thrown away, like the heart, for instance, we bring from the butcher shop and we prepare them. And then the arteries are cut, and these trainees have to show proficiency in closing the end to end of those little tubes that we know of as arteries that are the blood vessels of the heart, for example. So that seems like a pretty common lab. It seems like something task training, important task training if they leave this environment and then they end up operating on a real patient. Obviously, that's the trajectory eventually. But this lab itself requires a lot of preparation and a lot of surroundings to make it come off in a effective and efficient fashion. If we think about it, there has to be a curriculum that accompanies it. There has to be learning materials. Ideally, we would want these folks studying materials. What's the type of anastomosis that is supposed to be done? What's the type of sutures that are supposed to be used? Where can you do the anastomosis? Closer to the aorta, further from the aorta? Those kinds of cognitive things all need to be developed. Ideally, we want to show this information ahead of time so people can study it on their own time. And again, bringing in this blended model of learning. Then when they come on site, the senior professor who is there giving the feedback and giving the encouragement can do it at a much higher level. But operationally, if you think about it, we had many things that had to occur. One is the scheduling. We had to have the room available, we had to have the faculty available, we had to have the students available, and so on. We had to order these materials ahead of time. We had to make sure all the equipment was ready. We had to make sure that the troubleshooting goes on, so if there's a glitch in the system or a glitch in one of the pieces of equipment, that is taken care of. And then somebody has to clean the whole thing up at the end. All of that are operational details that are often overlooked in what people are planning for simulation center operations. A collaborative model sort of takes all of that off the table so that the faculty member doesn't need to concern themselves with it. The next thing we need to think about is, the curricular aspect and the assistance we can give them. Earlier I talked about data management. Well, we would like to gather feedback. We want to know from the trainees, did we find this to be valuable? Maybe we want feedback from the faculty, feedback saying, did our simulation center provide the support that they expected or demanded? What about assessment forms? The faculty assessing the students and passing this information back to the program about competence. This is an important aspect. And then how to analyze all of that data. Bringing it into a central database and making easily available reports is something that we do at WISER for the faculty members. Again, we're trying to remove administrative and operational burdens for the faculty members that create and teach our programs. Lastly, we want to be able to use this data for quality improvement and reporting to whoever needs it. So quality improvement for WISER and how can we do things better, quality improvement for our educational programs so that they can hone their efficiency and their effectiveness, and everybody needs to report data to continue the support of their simulation endeavor. This is critically important. So we create at WISER a model by which the faculty member, in this case a surgeon, can leave the operating room at 10 minutes to 3, walk into WISER at 3 o'clock and begin teaching. The curriculum is set up, the equipment is set up, they have that level of confidence, they know there's going to be a support structure, and that efficiency allows them to accomplish more. It allows them to teach at a much higher level than if they are the ones that have to do everything. If every time they had to run a lab, they had to go to the butcher shop and get the pig heart, they had to go to the operating room and steal the sutures, and they had to go to the operating room and steal the equipment and bring it down to the simulation center to conduct a lab, the lab's not going to happen. It's certainly not going to happen in a robust or regular format, as you can well imagine. So at WISER, we created a centralized information management system that takes care of the 4 components that need to be thought about for any simulation program or any simulation encounter. And that is, there's 4 core components, and that is the students, the faculty member or instructors, the equipment that needs to be readied, as well as the facilities, the environment that is needs to be secured for the training program. No matter what the training program is, these 4 components need to be thought about, they need to be taken care of. The requirements for those 4 components come from the curriculum. So the curriculum dictates what the students are going to learn, how the faculty are going to teach it, if you will, where it needs to be conducted, and the type of equipment that you need for support. The next thing is, if you take these curriculum level entities, they need to be scheduled. We have to, again, make sure students available, faculty available, facilities, special equipment are available. And then lastly, all of these learning encounters and activities are generating lots and lots of data. And the data management and the reporting is so important for simulation centers, particularly these days in 2015. Activity reports, efficiency, effectiveness reports, there's lots of things by which we want to analyze data and create new environments or create improved environments through the use of data. And then also, if you have this managed, particularly if it's automated, it lends itself well to be the core of a research environment for those of you interested in doing education research. This system we've created is a web-based system that runs WISER and many other centers, and that's called SIMS, or the Simulation Information Management System. In a separate video, I'll show you some more about SIMS and from a center director's perspective, how it helps with efficiency in operations. I'll also talk a little bit from a course director because I still do simulation besides run a simulation center. So thanks for watching this video. I wanted to explain a little bit about the collaborative environment or the collaborative model that WISER uses to take the staff of WISER, which brings the simulation, project management, administrative, operational, information technology expertise to the table to meet subject matter experts, instill some project management, and create learning systems that have the most efficiency and the most effectiveness that we think is possible. And that's all housed in our simulation information management system. And we feel like that model of collaboration allows us to expand our training programs and maintain quality. So thanks again for watching. See you again soon. Until next time, happy simulating.